My name is Dr. Matee. I've been working in the industry for the last 7 years at various clinics across UK, and I'm now the surgical director at KSL clinic. The recovery time for the hair transplant is split into 3 phases over the course of 2 weeks. First stage is the crucial phase where the hair follicles are really delicate. The transplanted hair follicles are really delicate. We expect you to look after them as per our plan. And then the next phase is just reinforcing, making sure that you're following our post-op plan in terms of washing your hair. And then from day 10 to day 14, you're trying to assimilate into normal lifestyle. And then after day 14, you live your life as if you've never had a hair transplant before. So FUE stands for follicular unit extraction. So there's 2 types of hair. There's follicular unit transplant with this FUT. So there's 2 techniques. The first technique, FUE, is where you extract, or the new term now they use is excise, single hair follicle. So with a small punch, you take 1 hair or 1 by 1. Okay, and which is now the most commonly method used now. FUT is a technique mainly used for where the extraction or the person doesn't have a great donor area, and this is where you take a strip and then individually then cut up the grafts to implant them later. So we tend to do minimum 2,000 grafts per every case, and this could be simply just a hairline. So if the case, and it can go all the way up to, there's no upper limit depending on the person's donor area. So typically a hair transplant at KSL takes between 6 to 9 hours. So a standard case can take up to 6 hours, and a longer case can take up to 9 hours, and that can be depending on the size of the case. Also depends on the patient, and also depends the type of hair the patient has. Facial hair transplant, which includes eyebrows and beards, they work slightly different in that we use a smaller punch to extract or excise the hair from the back, and we also tend to use thinner hair, so lower aspect of the hairline. And then again we use smaller incision, and you also have to work on the angulation and the pattern, the way you do the incisions for the hair to be transplanted. So here at KSL we give you a comprehensive 2-week day-by-day post-op plan, and thereafter we give you various options. So some people will have the medication option, some people will have laser therapy, and some people will opt out if they don't want the medication or the laser therapy. They would want PRP injections. PRP stands for platelet-rich plasma, which essentially involves taking your blood sample, typically between 20 to 30 mils, and then we place that in a test tube and we spin it in a machine, and then isolate the blood into different components. The bit that we're interested in is the platelet-rich plasma, and then which constitutes to about 8 to 10 mils. We then re-inject that under the skin with local anesthetic, and the aim of that is to promote a healthier skin and also a better blood supply so the hair can grow and